and Sadiq Khan joins me now. Thanks for being with us. So what is this plan?
Well, we know from the evidence of the Chief Scientific Advisor and the Chief Medical Officer that this virus is spreading exponentially across all age groups. In fact, in London, we know, unfortunately, that this virus is spreading across our city without the positive test being shown, because testing in London is still a mess, as indeed it was back in March. So what we're keen to avoid is a second lockdown, as we saw in March and April. And we've come up with a package of measures, cross-party, with various London leaders, additional measures to slow down the spread of the virus. And basically, they're learning the lessons from the North East, the North West and Birmingham, for example, reducing transmissions in the community by having everyone wearing face masks, not just in public transport and in shops, but in other public spaces as well. In hospitality, for all staff, as well as where possible, for customers to wear face coverings. For where possible, there to be few occasions when the transmissions can be passed. And we've seen, for example, in the North East and the North West, the hours that pubs and bars are open have been slightly reduced to slow down the spread of the virus. And the other measures we've got as well, and I'm hoping that the Prime Minister will invite me as the Mayor along to the COBRA meeting, right, and we can discuss in a grown-up manner the additional measures we can take to slow down the spread of the virus.
So you want a curfew in London, do you? On restaurants and bars?
Doesn't matter.
Restaurants and bars.
Yeah, the time doesn't matter. There's nothing magic about 10 p.m. or 11 p.m. The issue is the amount of hours people are spending together where they could be asymptomatic and the virus passes on. By the way, none of this would be a problem if there was proper testing taking place. And what we actually need is a fully functioning testing system and a fully functioning contact tracing system. The challenge is this. Here in London, we know that because the testing numbers have gone down in the last 2 weeks because they've been sent to other parts of the country, although the numbers of positive cases have gone down, the indications are the virus has gone up. And in the absence of a fully functioning testing system or a contact tracing system, we've got to slow down community transmissions. Right. This is what happened exactly the same in March, where we delayed in implementing measures which led to the need for lockdown.
OK, but I don't quite get how this curbs the spread. I mean, you're talking about more people wearing masks in maybe more settings and knocking a few hours off bars and restaurants. Is there anything else that you've come up with this plan?
There's a whole package of measures. I think there's 15 different measures, from funerals to weddings to the way the rule of six works. If your place of work isn't COVID secure, or if your means from getting to home to work aren't a safe way, then we're encouraging people, where possible, to work from home. There are other measures set out in relation to what we can do around care homes. We do know, for example, back in March, April and May, there was a huge increase in positive cases in care homes, which led to, unfortunately, huge numbers of people losing their lives and families still today being bereaved. So it's a package of additional measures we think can be taken to avoid the need of a further lockdown in our city or indeed across the country.
You mentioned what's going on up north. I mean, up north there's restrictions like, families not being allowed to mingle with other families and, households having to just stay inside, or where they can't meet people, other families, inside or outside. Are you planning that kind of thing for London?
What we know in London is the way the virus is spread in our city is slightly different to how it's spread in other parts of the country, where there could be intergenerational families. So at the moment, the additional measures that the council leaders and I have discussed with the public health experts isn't suggesting that households shouldn't be visiting other households, as long as they respect the rule of six. In other words, there shouldn't be more than 6 people together at any one time.
So you think the rule of six is working, do you? I mean, it's only been a week or so, but you think the rule of six is good enough, do you?
Not by itself, no, and that's why we're suggesting the additional measures. What's quite clear in relation to a number of the metrics we have, we've seen not just calls to 111, calls to GPs, hospital admissions, and other measures as well going up over the last few weeks. It's quite clear that the rule of six by itself isn't sufficiently slowing down the virus spreading. That's why we're suggesting the additional measures tomorrow to the Prime Minister and the government.
So you're not saying that restaurants and bars should close at 10 p.m. necessarily then. What is the limitation you're suggesting on restaurants and bars?
It's worth just reminding your viewers why 10 p.m. was suggested. It was to reduce the amount of hours people spent with each other, inadvertently passing the virus on. So we are suggesting, as one of the measures, to reduce the amount of time that the virus is passed on when it's asymptomatic and when there are so few tests. Hopefully, when the numbers of tests in London increases, when we have a fully functioning test system, the hours can be increased again as they've been done over the course of the month of August. We now know, unfortunately, because of the increased socialisation during August, that could be one of the reasons why there's been an increase in the COVID cases in London and indeed across the country as well.
What sort of limitation on hours are you talking about? Can you be a bit more specific?
We think one of the things that we think may work is in some parts of the country we've seen a 10 p.m. time, and there's nothing magic about 10 p.m. It's simply reducing the amount of hours people may spend with each other passing the virus on.
OK, I mean, you know, up north, I've been up north for the last end of last week, and the hospitality industry is deeply worried about it. I mean, you are the mayor of one of Europe's great cities, which is, many people would say, is creaking to a halt. Do you have concern about the casualties that could be involved economically and, you know, as regards mental health? Absolutely.
I think the best way to avoid an economic crisis and to compound the mental health crisis is to do with a public health crisis. It's inextricably linked. It's not one or the other. I'm really concerned about central London, about the central activity zone, about Canary Wharf, about footfall, the impact on transport for London and public transport. I'm equally concerned about the virus spreading fast at a level that led to the chief scientific advisor and the chief medical officer advising that in the middle of October...
You see, some people would say that should be your priority, getting London going again.
Well, my priority is to do more than one thing at a time. A health crisis is leading to an economic crisis, which has led to a mental health crisis. The way to avoid the virus spreading even faster is to take these additional measures. The way to do that, by the way, is for us to get around the table as grown-ups to discuss some of the experiences you've just talked about in the North East, the North West, with not just the North East, the North West, but with the leaders of Scotland, Wales, Northern Ireland, and the Prime Minister at a COBRA meeting, if not physically, but virtually. That's what we should be doing.
OK, and just in a word, do you think you'll be invited to COBRA, yes or no, in a word?
I hope so. That's a sensible thing to do.
OK, thanks very much indeed.